Council Resolution number 18 of 2022, requesting that New York State Governor Hochul and all New York State representatives acknowledge emergency medical services, EMS, providers as essential healthcare providers and include EMS in their final New York State budget. Do we have a sponsor? Councilor Genatino, second Councilor Castro.
Council Resolution 18 of 2022, whereas the City of Auburn and communities all across New York State rely on emergency medical services to provide essential pre-hospital care to our sick and injured neighbors as part of a comprehensive healthcare system. And whereas the EMS agencies have struggled for years to maintain financially viable operations in order to provide fair and appropriate compensation to the individuals providing these vital services. And whereas the COVID-19 pandemic has placed unprecedented stress on the entire healthcare system, including our EMS systems. And whereas on January 18, 2022, New York State Governor Kathy Hochul presented an executive budget for 2023, and whereas the proposed budget includes a number of considerations for healthcare workers, facilities, and agencies intended to improve recruitment and retention of essential healthcare workers and to provide the necessary funding to support community health. And whereas the proposed budget includes funding to support innovative solutions to streamline healthcare, and whereas the proposed budget considers adjustment to Medicaid reimbursements, and whereas Medicaid reimbursements have long lagged behind the actual cost of providing EMS services, creating an unreasonable burden on EMS providers. Now therefore be it resolved, the Auburn City Council does hereby request that New York State Governor Kathy Hochul and all New York State representatives continue to fully support and fund the essential healthcare provisions of the proposed executive budget, and to acknowledge EMS workers and agencies as part of the healthcare system. Be it further resolved, the Auburn City Council does hereby request that New York State Governor Kathy Hochul and all New York State representatives make the necessary adjustments to Medicaid reimbursements so that local EMS agencies can continue their vital work and compensate their dedicated employees with fair wages and benefits. And be it further resolved, the city clerk shall forward certified copies of the resolution to the governor and our state representatives.
Mr. Duggar, I realize we have both our chiefs here. Is there anything yourself or the president would like to add?
Mayor and councilors, as I reviewed the governor's executive budget proposal for 2023, there certainly is a lot of discussion, a lot of highlights in it related to our healthcare system. Most of that, when you listen to the narrative about it, focuses on healthcare facilities such as hospitals and nursing homes and things like that, which absolutely are important aspects of all of our communities across New York State. But one of the things that tends to get left off in conversations and has for years is the delivery of emergency medical services, including ambulance services. Especially over the last 2 years, we can certainly see it here in our community that much of the community relies on emergency medical services as their first line of choice, or their first choice, their immediate choice when they have a medical problem. Whether or not that's should be the case or not, they've become the de facto primary care for a lot of folks in our community. And we have seen over the course of the last couple of years, especially difficulty all across the country, all across the world, getting people into healthcare positions like EMTs and paramedics. So we are seeing that in real time right now. It's being experienced all across New York State, and we don't want to see the EMS system forgotten as we have discussions about improving working conditions and compensation for those in the healthcare field.
Chief wants to get anything, or are they good?
If Chief Fritz has got anything to add to that, he's more than welcome.
Good evening, Mayor, councilors. I'll just reiterate what the city manager said. I came from EMS a long time ago. It has always been a proud service but it has always been a service that has fallen behind in benefits and wages. The work and the hours are long, and unfortunately the compensation really doesn't reflect the dedication that these EMTs and paramedics put in. So that's kind of why we wrote this resolution to send to the governor, just as a reminder that, you know, there's frontline healthcare workers every day that are out there working hard, putting their life on the line, whether it be violence related or this pandemic. And we do want to make sure that they are part of the conversation moving forward, and they get the acknowledgement of the essential service they truly are.
Thanks, Chief. Counselor, discussion? Counselor Kent?
So I agree that EMS workers are critically important. I'm so glad to see this. And, you know, they're not only our default, you know, primary providers when there's an emergency, but they also are by default ambassadors for the city and for the healthcare system and the communities they serve. So it's a lot of responsibility. They have no idea what they're walking into most of the time. So I'm glad to see it and support it.
Thank you. Anyone else? Please call the roll in regards to council resolution number 18, please.
Counselor Kent,
Yes.
Counselor Genatino,
Aye.
Counselor Cuddy,
Yes.
Counselor Castro,
Yes.
Mayor Quinn.
Aye.
Carried.